What would that be? Nobody? Oh my gosh, come on, guys. I know you're sitting there and say, I know, he'll tell us. Differential diagnosis means what? How about something like this? When we talk about a differential diagnosis, get out of there. Well, I'll be darned. The process of differentiating between two or more conditions which share similar signs or symptoms. Have we addressed anything in this class so far where we might be able to say it would be essential to be able to do a differential diagnosis in order to feel comfortable that you have correctly identified a problem that an individual or a patient may be having? Have we discussed anything like that so far? You're differentiating. Differential diagnosis. Differentiating between two or more conditions which share similar. All right, so let's do something else then. Let's get over here. We're going to handle something that Solo asked last time we gathered. And she said, stroke. What's a stroke? So, if we look at this information relevant to a stroke right here, we can consider something like this, where we say, let's see, stroke. A stroke, stroke, stroke. Severe headache. Anybody here had a severe headache before? You obviously had a stroke then, right? How about this? Loss of motor skills. What does that mean? We've been making reference to motor and sensory for quite some time now. What does that mean? Loss of motor skills. Come on, guys, I need some input from you. Let's go. I'll wait. What does that mean? When you're sleeping, you can't move normally either, right?
Yeah.
Maybe? What do you mean?
You lose feeling, I forgot what the word you're looking for is.
What word are you looking for? Not the word I'm looking for. What word are you looking for? Go ahead.
Paralysis?
Paralysis? What does that mean?
You have no control over certain parts of your body.
Anybody else?
You don't have no control over the muscle movement? Over your muscle movement? You have no control over it?
Example would be what?
Like you couldn't move your arm the way you want to, like a skeleton, like you just have no control. Like maybe you might twitch or something like that. You have no control.
Okay.
Type of thing.
All right. Would you close the door, please? Thank you.
If you wanted to get up from here to there and walk, you probably couldn't control.
All right. Loss of some motor function, right? Voluntary. It's another one here. Weakness, numbness of the face and limbs. Solo, you were the one that asked the question. Let's go. Weakness, numbness of face and limbs. Have we talked about anything in here relevant to that that might be applicable for a confusion relevant to a differential? Are you having a stroke or are you having
The Bell's palsy.
Bell's palsy? What was that?
One of the issues that we had with one of the cranial nerves.
Okay, one of them. Which one would that be?
5.
Five. 5 was Bell's palsy?
7.
I did with the facial.
Is that right?
Yes. nerve number 5.
You're sure?
I'm positive.
You're positive.
I could
And
not,
all of you are agreeing.
I think I got that one wrong. I think it was Tick Delarue.
So wait a minute, which one is it now? Let's just pick a number. 3.
Okay.
No, 8.
Okay, well, 7 do deal with the facial expression, like the taste. But 5 also deal with the facial sensation. Like,
Okay, but there was one that you said, what was the condition?
It was Tick Delarue, and I could have swore it was 5, because I know I put the wrong thing and got that.
So wait a minute, which one is it we're talking about right now?
I can't remember which
Number
one.
5 is the homeostatic imbalance. You get the tick for number 5.
Okay,
Yes.
okay. And that would be consistent with something where we'd say a differential. They have tic Delarue or they have a stroke. Would that be accurate? Some of you are just sitting there agreeing, kind of, yep, I got it, bobblehead.
Just that they can present themselves similar.
Wait a minute. Are we on to, is it 5?
Yes, it was 5.
You're not agreeing?
No.
Why do you say that?
I think it's 7 with Bell's palsy, which is paralysis of the facial nerve on the affected side.
Did you hear what you just said? Any of you? I think she and I were just having a personal conversation up here. What did you say?
I said for cranial nerve number 7, Bell's palsy, which is paralysis of the one side of the face.
One side of the face paralysis. So what was the difference between whether it's tic Delarue or whether it's Bell's palsy then?
Tic Delarue is pain, isn't it?
Yeah, I'm asking the questions. Come on.
Okay.
Go ahead.
If I remember correctly, Tick Delarue is the pain in the jaw.
Tic Delarue was pain where?
In the jaw.
In the jaw.
A painful twitch.
Well, how does that differ from Bell's palsy, which is pain in the wherever you said? What did you say? Oh, I'm sorry, what?
I said Bell's palsy was paralysis, and then tic Delarue is a painful twitch.
So now we got to confirm this. Is this 7 or 5?
7.
7, yeah.
Oh, now you guys come out and say, yeah, it's 7. Weakness and numbness of the face limb, difficulty with speech and swallowing. What would that be most characteristic of? Stroke, right? Or
Bell's palsy.
what?
Glossopharyngeal nerve.
Glossopharyngeal. Glossopharyngeal. Okay, now we're throwing in a different. Which one is that?
That's,
Guys are a little rusty on these cranial nerves.
That's what,
8.
that's 8, cranial nerve 8, he just said.
Or just pick a number. 11?
No, it's
13?
No, it's 9. I think it's 11.
What is it? 9. 9, not so rusty anymore. It's 9 for sure? How does that fit in with difficulty with speech and swallowing? 9. Could it be 10? What was the concern with 10? Solo, I haven't heard anything out of you. You were the one that asked the question.
I don't think that was a question like that. I think I was asking about the other side of those.
You were asking something about stroke. You wanted to have some clarification on stroke, as I recall. And all of a sudden, you've gone silent. All right, we're trying to do a differential diagnosis here. We say severe headache, loss of motor skills, weakness, numbness in face and limbs, difficulty with speech and swallowing, vision changes. Does that link up with 7 or 9 or 5? Nobody wants to jump on that one?
I'll say yes.
What's that?
I'm saying yes.
You're saying it does?
Yes, because we're talking about, now that we mentioned 9, we're talking about tongue and throat, which you just mentioned it up there.
But I made some reference. This chart right here has something about vision changes. there was something about one of them that had, come on, you guys, jump in. You got the information in front of you there. What was it? Ptosis of the eye? What was that? Which one was that? Say it again? Oculomotor. Confusion, inattentiveness, drowsiness, or unconsciousness. Maybe members of this classroom right now. I don't know. Come on, guys. Confusion, inattentiveness, drowsiness, or consciousness. Could that fall with 7 or 9? Excuse me, 5 or 7? Let's go back and cook it on down. Cranial nerve number 7 was what? Facial. And what was it? What was the kind of homeostatic imbalance I tossed in on that one? And I said, this is a homeostatic imbalance associated with 7. Bell's palsy. 7 Bell's. And what was the other one? Cranial nerve number 5, which was what? Tic de la Rue, trigeminal. 5 ticks, 7 Bell's. 5 ticks, 7 Bell's. Okay? Tic de la Rue was going to be less of this stuff. This looks more like Bell's palsy. Would you agree with me? Yeah, do that. I'm not sure. Come on, guys, you're a little rusty on these. You're supposed to be up on these right now. Okay, so what do they talk about here? Let's do this. Integumentary, decubitus, ulcers, ulcerous situations here. And this is, say, interactions of a stroke with other body systems. It may be responsible for some of these reproductive disorders, urinary disorder, digestive, respiratory, cardiovascular, endocrine, and muscular could all be incorporated into some confusion associated with when we talk about a stroke. I'm going to introduce you to 3 people right now, okay? I'm going to introduce you to 3 different individuals, and at least one of them has some association with what we're dealing with right here, and you're going to want to pay particular attention as how they dealt with that situation. But it's important to understand when we talk about a differential diagnosis, you want to be kind of clear before you go and miss something or rush to judgment on something that may not necessarily be what's taking place. Let's take a look first of all. I'm going to take you on an obscure little journey here, and we're going to take a look at a guy. Some of you may have already heard about Phineas Gage. Does that sound familiar? You've heard of Phineas Gage before? Phineas Gage lived a number of years ago, okay? He goes back to, come on, finish up here. He was a worker on a railroad, 1823 to 1860. Talking about some time ago, okay? All right, you don't have to write down anything associated with this one. Just hang on here. September 13th, 1848. He's 25 years old. He was a railroad foreman. And they're punching road through this area, preparing a railroad bed near Cavendish, Vermont. He was using an iron tamping rod. Okay, they would drill holes down into the rock. He's using an iron tamping rod to put black powder in there, and then they'd put a fuse to it, they'd light it, and they'd blast it out. Vermont, Cavendish to Vermont is right up here, real rocky area. I was up in northern Pennsylvania in countryside that looked very much like the area where they were punching this through, and you could just see how something like this may have taken place. This is kind of like a roadbed that we walked on in that area of Pennsylvania where I was camping about 2 years ago. At any rate, they were punching this hole through this area right here. Here's the rod that he was using. So they drill a hole in the rock here. He's using this rod to tamp this powder in here. They have a fuse associated with it. You take steel and you take a rod. What could you possibly have? Maybe sparks, right? Maybe something like that that's going to ignite this. Unfortunately, the power detonated, sending the 43-inch long, 1 1/4, 1 1/4 inch, okay, steel rod, hurtling upward. The rod penetrated Gage's left cheek, his left cheek right here, right in here, tore through his brain and exited his skull before reportedly landing some 80 feet away. This steel rod, 43 inches, 1.5 inch diameter, had a point on one end, and it's just a rocket up through his head. I mean, you can just imagine he's just doing something like this with it, okay? This is an illustration of what took place, right through the top of his skull here. So, and they actually have his skull, and they've done some imaging of this thing so they can have fairly certain, this is 1994, they did a bunch of imaging to determine about how this took place. What lobe was involved on him? What dominant lobe was involved on him? Yeah, frontal lobe. Definitely left side frontal lobe. What is the left side frontal lobe involved with? Okay, frontal lobes are a lot of the personality stuff, but when we talked about, remember we talked about right and left? What's going on the left side?
Logic, math,
What is it?
logic,
Logical,
math.
okay, math skills, things like that. All right, some of those things were involved. So here's his actual skull, and they declare that it went right up through him right here. Now, they've pretty well been able to recreate what this looked like. They have his skull there, and they have the rod. Shockingly, Gage not only survived the initial injury, but was able to speak and walk to a nearby cart. This just blows me away. That we're talking in 1848. Okay? Taken into town to be seen by a doctor, Dr. Williams, the first physician to respond, later described what he found here. Phineas Gage holding his 43-inch, inch and a quarter steel bar that was blasted through his skull. There he is. Kind of a handsome-looking guy there. And here's the rod. Came right up through here, right up to his skull like that. I first noticed the wound upon the head before I alighted from my carriage, the pulsation of the brain being very distinct. This is really gruesome. Mr. Gage, during the time I was examining this wound, was relating the manner in which he was injured to the bystanders. I did not believe his statement at the time, but thought he was deceived. Mr. Gage persisted in saying that the bar went through his head. Mr. G got up and vomited. The effort of vomiting pressed out about a half a teacup of his brain, which fell on the floor. Yeah, dang. Soon after, Dr. John Marthy Harlow took over the case. It is through Harlow's observation of the injury and his later description of Gage's mental changes that provided much of the primary information that we now know about this. Harlow described the initial aftermath of the accident, literally one gore of blood. Later in his published description, Harlow wrote that Gage was still conscious. Later that evening, was able to recount the names of his co-workers. He even suggested that he didn't wish to see his friends since he would be back to work in a day or two. That's amazing to even consider something like this. After developing an infection, Gage then spent September 23rd to October 3rd in a semi-comatose state. Remember we talked about kind of a semi-coma type thing like that? We didn't talk comatose here, but on October 7th, he took his first steps out of bed, and by October 11th, his intellectual functioning began to improve. Harlow noted that Gage knew how much time had passed since the accident, remembered clearly how the accident, but had difficulty estimating size and amounts of money. Does that sound familiar? Why that might be the case? Didn't you just say that was kind of calculations, it was logic, it was mathematical skills, stuff like that? Within a month, Gage was even venturing out of the house into the street. After the accident, Gage was unable to return to his previous job. According to Harlow, Gage spent some time traveling through New England and Europe. He was now a sideshow. Okay? Do you understand? We talk about circus sideshows. With his tamping iron in order to earn money, supposedly even appearing in Barnum's American Museum in New York. Kind of like a circus act type of thing like that. Like many aspects of Gage's case, however, this is difficult to verify. Gage worked briefly at a livery stable. Can't imagine this. A livery stable, and we talk about all the horse manure and dust and stuff like that. And spent 7 years as a stagecoach driver. He went to Chile, went to South America. He was a stagecoach driver. He eventually moved to San Francisco to live with his mother. His health was deteriorating, okay? After suffering a series of epileptic seizures, Gage died almost 13 years later He was 38. Here's his skull. 7 years after his death, Gage's body was exhumed. His skull and the tamping iron were taken to Dr. Harlow today. Both can be seen. Harvard, go there. You can see the skull. You can see the rod there. Here's that photo of him. Amazing. Amazing to think in terms of that time, 1848, they were using, in the Civil War, that was, kind of Civil War era time, they were using cat dander, cat fur, for packing wounds. When you talk about the battlefield injuries in Gettysburg, the Civil War, and most of the time what it amounted to is that you ended up amputating rather than trying to heal an infection there. It is easier to cut it off in some cases with the damage that was done there. So amazing. Okay, I've got two other individuals I want to introduce you to. Two cases of brain damage here. Case number one, former Arizona Congressman Gabriella Gifford. Anybody remember that name at all? Gabriella Gifford, Congresswoman from Arizona. She was down in Tucson area. Saturday, January 8th, 2011. She's a U.S. representative for her state, Democrat. At least 17 others were shot the morning of January 8th when a gunman opened fire outside a supermarket where Gifford was meeting with, roaming around meeting with her constituents. 6 people were killed in the attack. A few days after the shooting, this is the bullet that penetrated Gabriella Gifford's brain. Entered posterior aspect, what side? Left side. What happens on the left side? Came right through this area, kind of lateral left cerebral hemisphere. Notice this, doctors said that it was too soon to know how much her brain has been damaged, although they have had to remove very little dead tissue, which is a good sign. They have been more concerned about secondary damage caused by the brain swelling. So what they did was they removed the calvarium. They removed the upper skull portion. Left side of the brain controls the right side, as well as, notice this, mathematical skills, language, and logic. The bullet passed through only one half the brain, missing the complex central area where the two halves communicate, corpus callosum, right? If the bullet had passed through both halves, any swelling of the brain would be more acute. So we're going to talk this evening here, we're going to get into some areas where we're going to talk about Wernicke's area, Broca's area, things such that are going to be important. We're going to make reference to these. But here's our central sulcus, remember that? Ahead of it is what? Primary, numero uno, okay, primary motor cortex. Posterior to that is primary somatosensory cortex. Real important to remember, you're going to hear about those terms again. So then you get to the premotor cortex, that's ahead of, that's forward of this, okay, anterior to the the primary motor cortex is premotor, before the motor cortex, essentially. And then you have over here the primary sensory area, but you have the sensory association cortex, which is over here on the parietal lobe going toward the occipital lobe. All right, so here's Broca's area. Broca's area in here. And here's Wernicke's area over here. All right, so I want you to just pack that away for future reference. We'll talk about that. On January 22nd, Representative Gifford reported that she would step down from Congress. This is a year later. 2011. This is a year later, 2012. Reported that she would step down from Congress this week to continue her recovery from a gunshot wound inflicted 1 year ago. I have more work to do on my recovery, so do what is best for Arizona. Okay, the gunshot brain trauma has in part left Ms. Gifford with aphasia. condition you need to know about is called aphasia, A-P-H-A-S-I-A. Difficulty understanding, difficulty speaking, difficulty reading, difficulty writing. Aphasia. I would encourage you to go to a YouTube site and bring up Gabriella Gifford and listen to an interview there've been a couple of interviews with her. I don't know about one most recent. The last one I saw was about 3 years ago, something like that. Anyway, Broca's area is where we formulate speech and the area of the brain that sends motor instructions to the motor cortex. Okay? Injury to Broca's area can cause difficulty in speaking. The individual may know what words he or she wishes to speak, unable to do so. You see that in the interview with Gabriella Gifford. She also walks with a limp. She doesn't have use of one arm. Which arm and leg do you think is impaired? Which one?
The right side?
Right side? Okay. Situated in inferior frontal gyrus. Are we good with gyrus? Good with the term called gyrus? The dominant hemisphere is on the left side in a right-handed individual, Broca's area. It forms the speech by its connection with the adjacent motor areas, muscles of the mouth, the pharynx, and larynx. You have destruction of Broca's area here, paralysis of speech, motor aphasia, in which the language is understood, but it cannot be expressed in speech or writing here. So we have Broca's area right here. We hear something, person tells us something, we hear it, we process it Wernicke's, it goes to Broca's, it goes to the motor cortex, we're able to comment relevant to that, the interlinking of these areas. Listed below is a link to a TED Talk with Gabriella Gifford that was in 2014. She's actually on, are you familiar with TED Talks, any of you? Okay, this one was an interview in 2014, so it's not very long after that. I doubt seriously whether there's substantial additional improvement from the one that I saw most recently. In this interview, you're able to witness the effects of aphasia, and as a result of the damage inflicted from the gunshot. Also note the contralateral impact, opposite side, of the damage done as a result of the single bullet that impacted the left hemisphere. Miss Gifford has partial paralysis impacting her mobility on her right side, as you said. Okay? Okay, but this is a real good piece of information. She's with her husband, Mark Kirk, who was able to be elected into her vacancy. Case number 2, somebody local. Mark Kirk. What did I say? Mike? I think I may have said her husband's name wrong. Gabriella Gifford's husband's name, okay. Anyway, former United States Senator from Illinois is Mark Kirk. Right here in our area here. This is January 2012. Senator Mark Kirk checked into a hospital in northern Chicago suburb, Lake Forest. Headaches and dizziness. Headaches and dizziness. How about that? Did we talk about that just a few minutes ago? Headache? Dizzy? Okay. He was transferred to Northwestern Memorial Hospital. The senator's office said Kirk is reported to have suffered a stroke, an ischemic stroke. Okay? An ischemic stroke. The ischemic stroke in which blood flow to the brain was impeded by blockage. There was some blockage to the supply of blood going to the brain. In this case, through the carotid artery. You have arteries and you have veins, right? Both sides. Carotid artery is carrying the blood up. Veins are bringing the blood back down. Carotid artery impacted the right side of Kirk's brain, his right side. Okay, according to Dr. Fessler, who performed surgery on him, it will affect his ability to move his left arm, left leg, and possibly involve some facial paralysis. Okay? Had it happened on the left side of his brain, it would have affected his ability to speak, understand, and to think. If it had affected his left side, if it had been on his left side, wait a minute, that's what we just saw about Gabriella Gifford, didn't we? Okay, so we're very hopeful that when we get through his recovery, all of those functions will be intact. We're happy with his current status. Fessler told the doctor said the senator was under sedation, neurological intensive care. Okay, due to his young age, this guy was 52. Good health, nature of the stroke doctors are very confident his ability. On January 3rd, Kirk returned to Capitol for the first time. He returned to his role as senator, using a cane or a wheelchair for assistance. He was defeated by our current Congressperson, Tammy Duckworth. Okay, there here. All right. Aphasia. So, how do you differentially diagnose a stroke then? Now we go back to what took place here previously, and we talk about the differential diagnosis that we want to be able to, let's feel comfortable with. Don't need that. Let's go back to this. We're talking about a differential diagnosis. How do you know? What prompted Mark Kirk to take the action that he did? What were the things that were mentioned there about Mark Kirk?
Weakness, headaches.
Okay?
Sound like
He had some dizziness and he had headaches, right? I mean, that's what we're told. We don't know what other types of circumstance were mentioned there. It says severe headache, loss of motor skills, weakness and numbness, face and limbs. Could that have been Bell's palsy? Apparently so. So, oh, don't worry, it's just Bell's palsy. Or, let's go get it checked out. Let's see if it's Bell's palsy or it's something worse. Do you understand what I'm talking about here? The differentiation of one or the other. One of them has much more catastrophic, we could use that term, has much more life-threatening implications as compared to the other. And so when we consider the possibility here, these are the symptoms or these are the things, you're going to wait around and just say, well, let's see, you feeling kind of tired? You feel like you're having a seizure or so? You're having difficulty with speech and swallowing? Some visual changes? You start checking off the list here, some things, and you just start saying, okay, maybe this is something we need to hustle, get you to the hospital. I mentioned to you in one of the last pieces of information we talked about, there is a clot buster that they've been using for individuals that have been identified as having a whole lot of presentations relevant to the possibility of a stroke, and so give them that treatment there. The treatment varies depending on the type and the severity, restore the blood flow or stop the blood loss, because a stroke could also be a hemorrhagic stroke where you're actually having blood loss. Okay, so ischemic stroke is the one that we talked about with Mark Kirk here. He's the one that had the blockage there, but there's also one where you have a rupture of vessels in the brain area and now you're having hemorrhage there. Long-term treatment may include hypertension, medication, physical, and speech therapy may be involved in those cases. Okay, is there a question about differentiation when we talk about differentiation? Do you have a cold or do you have the flu? How are you going to differentiate? I mean, colds are virally produced as well. Okay. Well, something to ponder, I guess. Hopefully you never have to personally deal with that, but never know. Could be.